meeting. Look at all
Yeah,
this.
that's kind of crazy.
So then
Okay, we
because
call meetings order.
weeks later, like, what
They're
the
done
heck
now.
do you
You're here.
Okay.
Okay, order in the court.
I mean, hello.
And are we started yet? Yeah. So
Yeah.
unfortunately, we're starting this meeting again with a sad heart. We have to do a moment of silence for the St. Croix officer who we lost over the weekend. So another horrible shooting. So we could take a couple minutes for a little moment of silence. That'd be nice. Okay, thank you, everybody. We don't have to do that again. Keep doing it. Okay, I'll take a motion to approve the agenda.
So moved.
Second. All in favor?
Aye.
Opposed, same sign. Approval of the minutes from our April 11th meeting. I'll take a motion of approval. So moved. Second. All in favor?
Aye.
Aye. Opposed, same sign. Comment. Okay, no public comment. And receipt of information of supervisors not seated as committee members. I don't see anybody here, so.
Besides Jay Luke.
Well, I'm here to learn, not to talk.
Okay. All right, well, let's dive into the guts of this, the public transportation study update. So
Right.
this is what we got handed out last.
And I believe that the clerk's office sent out copies to everybody, so if you did not get a copy, let us know, we'll make sure you get one. So from there, Laura came last time and we talked through the results. Edwin also presented. So we had some homework to do. We've met with Vince and discussed how we figure out transportation needs in the county. And through Laura's office, she's gonna do some shifting of staff. The rest of this year will basically be to position ourselves to be able to apply for the grants for next year. So she's got her staff working on setting up what it's going to look like to have a mobility manager in that office that they'll share with the county. So she's doing that. Our grant timelines are later this summer for making application. It will be mostly fully funded. I think there's a 20% local match that we will be splitting with Burnett counties. So our cost is relatively low to start mobility manager services in the county, in both counties, Burnett and Polk.
It's so great that ADRC was able to step up on it. So that'll include, questions or comments?
Wonderful, thank you.
Full steam
I
ahead.
just wanted to reiterate something there, just to make sure I heard you correctly. So the cost for us to make that move for a mobility manager is low to no cost.
Correct. Mostly grant funded.
Right.
I believe she'll be putting through some requests through the budget process. If the grants don't come, the position won't come for the 2024 budget. So it's all dependent upon being.
Right, and if the grant money's there, the position's not there. And the reason I ask that is because, again, in the court of public opinion, there's a popular argument right now of not wanting to use taxpayer dollars to fund public transportation, which is a pretty gross misrepresentation of what's going on. So I want to make sure that we can, where we can, correct that information and make sure that the right stuff is getting out there.
Yeah, good point. Thank you.
And that's 10% of their salary benefit, the cost of that person's.
Right, yeah, it would be a position, so 20% match, local match that we split with Burnett.
So Polk County, it's 10% of whatever they are. That's the cost.
Yep.
If the grant comes through.
Correct.
And from what I remember from Mr. Rothrock, it was likely. We're well positioned given who we are and where we are.
Yep, yes, correct.
That's not a huge investment for a big return. Very good. Well done. Okay, number 7, discussion possible action on resolution 1923 to support the utilization of state surplus funding to offset supplemental payment decreases in FY 22-23 and to continue future CPE award dispersions to county-owned nursing homes. Who came up with that title?
Not me.
If this was Facebook, I put TMW. Too many words.
Hello,
Okay. Oh, hi,
Hello.
Diane.
hello,
Welcome.
can you hear me?
Yes, thank you.
All right, I kind of got cut off there. So, would you just want me to give you guys some background on this?
Please. Yeah, that'd be
Okay.
great.
So, all municipal county, owned nursing facilities in the state of Wisconsin have received supplemental payment funding. For many decades. It's been a long-standing program. Typically, it is a rate set or an amount set on the amount of Medicaid patient days that a facility has. So in the past, based on our census, we have received anywhere from, most recently, I'll say anywhere from $800,000 to $1 million in funding each year through this program. In December, we received our award letter, and it was much lower than what we had expected or budgeted for. So these amounts we budget for every year based on historical amounts, based on what our state association, Wisconsin Counties Association, what those organizations help us with that budgeting process. Then shortly thereafter, there was a meeting in Madison because we, of course, weren't the only ones that were surprised by this. And what happened is DHS changed the methodology for how they came up with the amount. So there's $39.1 million in this program that's distributed across these the facilities. And basically the change was made not to go off of straight Medicaid days. They funded everyone's direct care deficit. And we have always tried to be really good stewards of our budget, and we keep that as tight as we can. So we have one of the lowest direct care deficits across all of these facilities at $64,000. Therefore, the state was, they were thinking they were doing this a good thing by funding all the direct care deficits. But for example, Dane County had an $8.4 million direct care deficit. And other facilities have a 1.6, 3.2, 2.8. So just these huge direct care deficits that were funded, where we, didn't have that big amount. So we're ending up with $94,000 in total of the 39.1 million when we were expecting closer to 800,000. So huge shock to us and many of our many of the other facilities across the state. I think there were 22 that had significant decreases. So what we're asking is for some surplus funding to supplement that amount, also for the DHS to revisit how they're going to do this in the future, because at that meeting they basically told us, this is what we're doing. We were up against a deadline. This is how it's going to be. They have since identified, that there is a problem with it, but we haven't heard of any changes forthcoming. And typically in the past, DHS has worked with Leading Age Wisconsin Counties Association, all of to get some of us providers at the table to help with that process, which they didn't do this year because of their deadlines. So that's in a nutshell what we're looking at here. So I know this is all new, and you probably have questions or maybe don't even know what questions to ask, but basically, yeah, we're just looking for Lincoln and Marathon counties started this resolution, and it hasn't or according to Leading Age Wisconsin and Wisconsin Counties Association, the legislators are looking at it. It's so hopefully we can just get there and show them that we need some changes.
So Dan, is this to specifically go to DHS, or is this also asking for us at Polk County to shift some money around?
No, nothing at Polk County. This is just to go to DHS, to the legislators to show them what happened, you know, we're just asking for the state of Wisconsin surplus funding to help with that. To help with those of us that saw the significant decreases, so it would just be state funding. And then again, the biggest thing really, because I don't know that any changes are going to be made there, but the biggest thing is just to review and revise that payment methodology so that it can be more fair and consistent again, so there's not such huge winners and huge losers in the program, for
Right,
lack of better words.
right.
Madam
Any other
Chair?
question? Yes, go ahead.
Yes, so just to wrap my head around this. So
Yep.
this, did not go anywhere near the budget. So you weren't assuming an $800,000 income in the budget at all, right?
We were, yep, so that's what we budgeted for, and then we received notice that we're actually only getting $94,000.
Question for finance folks. Is that a good thing to budget surpluses?
It's not a surplus. No, what the budgeted item is for the supplemental payment. So the supplemental payment program has been around for decades. It's been very solid. It's something that we've always budgeted for because it's a program that is for municipal and county owned facilities. So we've always budgeted for that. And we've been able to budget very closely for it because the methodology has always been the same and been consistent.
Okay.
Yeah. And maybe Don has more to add, but yeah, that's how it's always been.
I think our concern is for current operating year and subsequent operating years, if the funding formula doesn't change.
Well, otherwise you can't put it in your budget.
Right,
If you don't have a good formula, you can't.
right. And that's, you know, the problem is that that's how we've always budgeted. And then we found out after the fact that they changed their methodology, which, yeah, it's a huge, huge issue because again, if everyone would have known that they changed the methodology, we could have all spent loads more money on direct care and been reimbursed for it, but that's not how, you know, we operate for sure.
Oh, yeah.
So-
Okay, anybody other questions?
Yeah, so might we expect some future conversations with you about how to deal with this shortfall?
Yeah, and that's what we're hoping, you know, if we can put this through, that we will get not necessarily me, but our groups, our advocacy groups will get a seat at that table to review that methodology. So we will know what to budget in the future. It'll be an upfront amount that we can, you know, because right now, the way this is, we're dependent on the operation of all these other facilities. Because if Dane County loses, you know, $8.4 million again, they're going to get that 8.4 million. And I don't know how the other facilities are operating. So it's really, I mean, it's just crazy. It's just a crazy system for everyone to be dependent on everyone else's, you know.
I have a comment, if I could.
Yeah.
You know, that really encourages fiscal irresponsibility on the part of the providers, and it's just silly. I mean, you've done well with keeping your losses managed and trying to work within your budget, and you're being penalized for it. You know, that's silly.
Exactly. That's exactly how I feel.
Yeah.
Yeah.
That's unfortunate.
Anything else?
So I think my question is about this fiscal year and how you run Golden Age Manor. If this deficit doesn't get corrected, you know, through your conversations with the state. So that's what my question was about.
Sure.
Are we going to be, you know, do you anticipate being in conversation with us about what you need in order to keep things moving there in a good way
Sure.
during this budget cycle with this kind of deficit riding
Yeah.
on your back?
Yes.
Okay.
Yeah.
I assume so, but I just wanted to make sure.
Right. Yep. Yep. And I've been in contact with Don, you know, from when we first found out about this, and yeah, it's something we certainly didn't expect, but yes, definitely.
Okay, thank you.
And we'll be
Maybe
seeing
the
those via.
Deficit will be larger, you'll get more money.
next
I
year.
know, and that's just it. That is exactly it. That's the crazy part about this. It's like, now I'm hoping that other facilities aren't just gonna go and raise their CNA rates and, you know, all these direct care dollars that are, I don't know. I don't know what to expect, you know, people could. And then if the methodology changes, they're gonna be, you know, in a bad spot. So we're not doing anything like that, but get some answers here on what the future looks like for the program.
So we'll see those changes via amendments, correct?
Yeah, Don.
Budget amendments or,
I don't know that yet. It's
Oh,
early.
you talking about our budget or the state's budget?
no, if they need more money.
Well, we don't get, we don't. Maybe Don wants to answer it.
Yeah, so GAM is an enterprise.
Yeah.
They need to be self-sustaining. They do have they do have a reserve fund. So if they were to run a deficit this year, they could draw from the reserve. Again, the question is, long-term, we need to find a way to replace those dollars. Hopefully the state will just change their allocation formula. One thing that's, I mean,
Right.
basically Dana was penalized for running
Efficient.
tight ship. Counties that didn't do as well. That's a first incentive for.
Anything else? I'll take a motion from somebody.
I'll move to, I would like to make a motion to approve. So I don't have to read that all, do I?
No.
Okay. Resolution 19-23.
Second.
Second. All in favor?
Aye.
Opposed, same sign.
Madam Chair, I got a
Thank you.
for being late. I thought it was at 10 o'clock there. I said drinking coffee and I told him, oh, wait a minute, we changed that.
Nope, you're right.
That was
Yeah.
my fault.
No, you're fine. You're good. All right, we are now at 8. Discussion possible action regarding resolution 21-23, resolution to create a municipal housing partnership. All right, who's gonna?
Yeah, Mr. Olson is not here. He came to General Government Committee yesterday initially to discuss this, but he has changed the resolution substantially. So he just gave a public comment, but I think we can talk about what his overall approach is. And when this is rewritten, and we're working on a draft now, in essence, it's creating a revolving loan fund to be dispersed, applied for by municipalities or, villages, cities, towns. So anybody would be eligible to apply for this with the purpose of incenting housing development. What it does is give the local government free rein to determine what the best housing is for their community. And he's talking about, and his new resolution will ask staff to refine and define the program and then propose it in a resolution to the committees and the board. So for an example, developers have a lot of costs up front to even consider where they're going to develop and build. A village like Milltown or somebody may say, we would like some housing over in this area. We have some land or whatever. But when a developer and them engage, the city will require, or the county will require studies, environmental impact studies, drawings and maps, runoff, all those types of things, and it costs money. So the thought being, it could be used for that. It could be used for infrastructure costs. It could be used for a lot of things. But it would be something that once it is used by the village and they share it with a developer or enhance their efforts, it gets paid back to the county down the road when those houses or units are being developed. So
This tied to the housing work group.
yes, I think, yeah, and I know Ryan asked the question yesterday, where is this committee? But I think we were waiting for to make sure it was on our priorities for the county. And now we have a couple of divisions who are starting to break down what the objectives of that might look like and what types of action we'll do. But I do think this is the first start. And I know we've talked in the past, it's very hard for the county. It's not one of our mandated services to start saying we're going to get into the building business. You know, we don't do that. We don't have the resources or the tools to do that. But if we can incent and provide some type of support or counseling or consulting on how to do that, we think, you know, I know Terry Hauer has indicated there are a couple of communities that have expressed interest in this concept. So this resolution that's here is not what is going to be voted upon. It's going to be redone.
Anybody have comments?
I think it's excellent that the county would consider this kind of a plan to give developers incentives. And that's really what you're doing, incentives to consider building in.
And it, you know, I don't know that we want to say, hey, we're going to give developers money. You know, I just had a house built and I
You're
gave
gonna give incentives
I gave him a lot of dang money.
and try to remove some of the obstacles.
Yes, and so a village or a city can use that in a way that will get a developer to say, I'll do it in Polk County as opposed to St. Croix County or Barron County or whatever. And it just shows we want them, it will reduce the cost for them a little bit, but they do pay us back.
Yeah.
When the houses are being developed. That's the concept.
So in other words, wouldn't this concept
Free
be
money.
similar to TIF district that the county would get paid back?
Well, not like, we don't have TIF districts. Counties cannot have those.
I know, but that concept,
Well, it's not related to property taxes for us. This is a pool of money we'll have that could be a certain amount to be allocated to that village. So they take the money, they have to incent or invest that wisely because after a certain time period, if nothing's been developed, they have to pay us back.
I guess what I meant was the county would get paid back in so many years, the same as the TIF district gets paid back.
Well, that's true, yes.
That's what I think.
Yes, thank you.
So that would almost be like a guarantee.
Right.
in the underwriting.
Right.
'Cause that's the important part, is to get paid back.
I would say the important part is to make sure that housing gets addressed.
I'm very passionate about this whole affordable housing thing, and I was shocked to be watching the coronation, and they were talking with a few of the spectators, and the resounding theme was like 20% of the population live in dole houses or government-owned homes, and they have a gross lack of affordable housing in England. So we're not unique to this, you know, but it is important and it needs to get done. So here we are. I think we said this at our meeting at the nursing home. It's like, okay, we want to do it. And now here, how many months later is that? I think we need to draw the line in the sand, say, okay, let's do it. How do we need to do it? Who's commissioning? I see it being commissioned like a working group, right? A task force or something like that. So you got cheerleaders, you got the supporters, and then you have the worker bees. And is any of that happening yet?
Well, if much like, you know, when we talked about the board priorities, housing is one of those now. And we'll get into that here pretty soon about what the next steps are. And that in essence is what we have. We have objectives where both HHS division and environmental services division have laid out some ideas of how we can proceed. So the next step then will be for this committee and the other committee to provide input, suggestions, tweaks, new directions or whatever. And you're right, this is not just a Polk County issue, it's a statewide issue, it's a national issue, it's a world issue. So and looking at what the county can do is one thing. It's easy to say a big city can develop something, but in a rural county like this, you have to be a little bit different in how we can approach it.
Yeah, and this this proposal and what you just talked about, kind of, to me, sounds like those closing costs that seem to snag and trip everybody up, so. Which are, for the most part, pretty fixed.
I don't think these will be closing costs. I think the way it'll be designed, again, is at the front end of development. It will be that thing to get that independent contractor, that person to come in, or a government agency, you know, or a group like WIDA or someone to come in.
Yeah, but perk testing, filings,
Yes.
permits, all of
Right.
that stuff, I just see that as kind of a one of those fixed costs to property owning, along with, you know, your closing costs and stuff. Yeah, it is a barrier.
Madam Chair.
Yes.
Denise, I'm the representative to our Polk County Housing. We have 9 units and operating just exactly what you're talking about. And with the housing demand and everything, and I made the comment to Wisconsin Human Services at Wisconsin Dells. And this is the same all over, only in some cases worse. You know, where you have people, you know, living in tents and that. But I thought that someday with the need out there that we'd probably expand to some more units. And boy, there is, talked to some state representatives, and that's the farthest thing that they're, from any of their thoughts, that it's a program that works so well and helps so many people, especially those in need, income and seniors and everything, primarily seniors, but quite a few handicaps. And we have such a successful program, and there's no, did he almost happen? Oh, no, that'll never happen again. And why? The need is there, and there's money there if it's just not in the right hands. That's my comment.
If I can take a second.
Go ahead.
So I like Supervisor Olson's idea of providing a pool of money for municipalities to have access to and to use that money however they see would be most beneficial to their area. I think that is a great approach, because one of the problems that we've had as a group is trying to figure out how to create a one-size-fits-all program for a problem that has so many different needs. So I do think that the way that it's set up to be, or to allow municipalities to choose where that money would be most useful is great. The hope that I have for this particular resolution is that we do some more due diligence in going to the municipalities and saying, here's an idea that we have. What do you think? What is your feedback? Is this useful to you as is? Is this something that could be tweaked in order to be something that you would pull the trigger on? I asked in previous meetings, you know, what municipalities have been brought into the loop, and I haven't gotten an answer. I've gotten so-and-so is supposed to go do it, or that there are certain municipalities that are interested, but I don't know who. And so I think before we put a idea out there for the board to consider, I think we need to get some initial feedback and do our due diligence beforehand to make sure that we have something that there's interest for. It's the same kind of feedback we got on the senior housing initiative prior. Like, how do we know that this is going to be something that developers would use? It was something that we heard all the time. So I would like to say the same thing. How do we know that this is something that municipalities are going to use? Moving on from that point. So my first point is that I hope that we do our homework beforehand to make sure that we have, not to make sure, you can't guarantee it, but to do our best to try and have an effective program put in place that municipalities see value in. The second thing is, I don't think I'm going to knock anybody off their podium in how they think about this thing, but I just want to voice my concern on starting from the point of the number one concern being that the county gets paid back. I think is a possibly ineffective way to approach things like this. I understand and I agree that it's important that the county gets money back whenever and however that we can. But I also think there's something to consider in the cost benefit analysis of this. When money is being invested in something, if that money is not invested, what is the cost to us? So if we're sticklers on making sure that we get every dime paid back to us and the program doesn't get used and people continue to exit from Polk County and we lose, population, workforce, school enrollment and things like that, the cost is going to come to us anyway. So I think there's a balance to be struck on how we approach, are we solving the problem or are we just making sure we get the money back, regardless of what the plan is? Because I've gotten feedback from people in Milltown that said $75,000 will pay for the paper we write the contract on. So I want to make sure that we are trying to have an effective program and not just, one that we make sure that we get paid back so everybody can feel happy. That's where I'm at. Thank you.
Thank you. Okay.
Madam Chair, before you have any effective programs or anything, you have to have the effective task force to push forth a recommendation of all of those interested parties that need to be on that task force. All of those people that are currently running the housing in the different towns. And let's, take a deep breath. Because if I knew how to write a resolution, or I could come and sit down and with the legal beagles and draft up a resolution, but it's me in a room with legal beagles. That means shit and shinola to anybody, right? So the thing that is going to work, that's going to be really, really meaningful, is going to come out of that working group. If you have the right people in that working group. That's where your ideas, and that's where the good solid stuff is going to come out of. Not giving incentive to build, to builders to come in and build to make money. I think we could all agree Fox River probably had a lot of trouble with or a lot of people hating on the people that decided to bring in it's a chip company, a chip making company down in Fox River that never happened. We do not want that to happen. We want success. And I keep bringing up things like the houses that Eastman Kodak built, the communities that 3M built. My son lives in a house that Rochester Mayo built. Whole communities. It might be something more creative than that, but that's one of those options, so I just think you need to start, and the starting point is not making a resolution in a room, either writing it by yourself or having somebody help you write it. Okay, it's going to be, this is what we recommend. These are the steps the board can take to get there. This is how much it's going to cost. This is going to be what the labor and intent is going to be on a high level. So that's my thought. And you guys can tell I'm pretty passionate about this. Lack of affordable housing.
Basically, you're saying take it to the streets to get some feedback.
Yeah.
Rita, did you have something to add?
Oh, I just, if I could make a comment, I think that's what you're saying there is what is trying to be proposed by giving, incenting builders. Because then you will have the local communities saying what land and what resources can be best used to work with that company, instead of just somebody coming in and doing it without their consent. I mean, I think incenting, because we're not going to build the houses. I mean, we got to have a builder to do it, or somebody that builds to get this going. So I think that's kind of trying to achieve the same purpose, kind of saying the same thing, but in a different, you start by at least letting, I think what Ryan said about doing the due diligence, letting the communities know that this money is out there, would be there for them to work with, builders. That's a big start. And then they'll at least know it's there and they'll get motivated around it, to do something. And we can't specifically say what each community can do for themselves. I think incenting them is a good idea. That's just my thought. It's kind of just which way you approach it.
I think we're kind of getting ahead of this. I think when we get into the housing priorities that the board set, I think you'll see kind of what Bob and Tanya have already laid out. It is a broader looking picture. And right now we're kind of talking about all the what ifs. I think you can get a start over here.
One might also look as a Mr. Franzen of the Franzen Bank in Luck built, I think, 8 units in these communities. I think they're all connected to each other, but that's another example of somebody doing something in their community for their.
I could see a Dr. Lagus housing development.
Okay. We expect big things coming now. Okay.
We'll all bring it forward.
Yeah,
And
okay, so
participate.
Number 9 is discussion regarding county board priorities. And before we start that, I hope you guys, this kind of connects. We had this handed out. That'd be great. Oh my gosh, you guys did an amazing. I don't know where every time I read these things, how much work is done under this, in this division, so thank you. for a huge amount of work. Thanks for looking at.
Right.
So, board priorities, is that? Control this maybe a little bit, or do you want me to? Okay.
So this is, I think this has been shown in a couple of committees now. I know Bob's committee for sure.
Right.
This is the work that is a result of your meetings with Bob for the goal setting, the priority setting, those one-on-one meetings that you guys have done. So this is the, everything wrapped up and put into some goals, priorities. So number 1, increase public safety, reduce crime, reducing substance abuse. Those were carryovers, I believe, from last setting period. Improving county infrastructure, supporting housing initiatives. That's a new one that made it up. We're just talking about expanding broadband access. I believe that's a carryover. And investing in parks, tourism, recreation. That might be a carryover too, or
That's
morphed. Yep. Okay. So you can see different colors on the chart. Where we're heading with those.
So.
I think we saw it at last month's board
I didn't
meeting.
see it. That's why I missed. So,
So on your x-axis is effort over time, and then the y-axis is time. Notice that, can I?
Yep, please.
Parks.
So this is just a visual to show where we're at with these priorities from 3 years ago. Notice 4 of the 6 are carryovers. Again, increasing public safety and reducing crime, reducing substance abuse, expanding broadband, investment in parks and tourism, again, are carryovers from 3 years ago. If you notice broadband, which is in blue and green, that's parks and tourism. We're pretty much, say this is time, this is your time axis. We're starting to complete a lot of the objectives within this 3-year poster plan. There's still work to be done, but over time, we should have met the goal of those 2 directional statements. The new ones are supporting housing initiatives and improving county infrastructure, in particular roads and bridges. There's a flaw here. This should actually be more flat. But in a way, it's kind of like a wave. Where again, all these emerging priorities, some are on the decline and then some are continuing to merge. We all know that the reduction in crime and substance abuse are huge tasks, very complex issues. And so therefore they made it on to the subsequent poster plan as we move forward. So again, this is just a visual to show, to demonstrate our priorities and where each priority is at. The next step in the process, which, Tanya is bringing forward to you is the next slide, which is the assignment.
Wait, go back.
Go ahead.
Okay, so it would help me, or maybe the public that's looking at it, if we had the axes defined, because I just look at it and I'm like, what are those mean? And then the bottom one, it's not intuitive to know that that connects. I don't know, maybe just a little bit more meat on exactly what I'm looking at.
Amy, we, our original slide had
I'm looking
time.
for definition.
We had time, months and years,
Okay.
and we took it away. It was a little busy.
Or just say that it's months or something like that.
Bob,
Okay.
can I get a little clarification? I don't understand where you're blue and green and then you're gray, where they take that dive there. Are you saying that because of the completion?
Kind of.
They're not completed, Supervisor,
No, but
Yeah.
they are near completion. For example,
so that is the reason why.
correct,
you
yeah.
See the dip there.
Right, a great example would be the investment in parks and tourism recreation,
I
as you
I
know.
was totally
Mhm.
misunderstood as to what the dive was accomplishing there. But
Right, if you can do a snapshot, we're probably around right here. May 2023, we're kind of on the decline with the implementation of all the goals and actions within broadband and in parks.
like
So-
where we're up on number 80 there, so you're saying that is the, but it has to be prioritized because of the high.
That was the time, well, I'm saying we're about right here, so a few months ago, last year, particularly last fall, we were really working very diligently, peak effort on those two initiatives. That's why.
So
they're key.
the higher, the higher the scale there, the higher their priority, correct?
Correct, this is your effort percentage, and then
Okay.
there was a time scale here.
Yeah, see if we had effort percent
Yeah.
defined, and maybe even just say time. I don't know, it could give us answer that question. I think also to follow up on John's question, the one thing that I think just in communicating this just strikes me as the blue and the green, well, the gray too, but basically we're not saying that we're done with parks and we're not saying that we're done with broadband. We're just saying that the PTAG initiatives and the specific broadband grant, those were peak effort and we're implementing them and we're almost completing them. It gives us certain sort of unfortunate in my, like, I look at it and say, well, does this mean we're like tailing off on broadband effort and parks and trails? And that's kind of what we're saying there. Is that
That's the
what-
one that caught me with
Yeah.
broadband.
Are we saying that?
It's for the priority. It's part of their work to identify what the new priorities, or if there are new priorities. So if you're only sustaining, maybe that's just instead of a 0, you just move it to a sustaining. So basically we're sustaining the gray, the blue and the green. But you see that the yellow popped up and you have 3 clear priorities up on the top. And those kind of get translated now over to that chart instead of the ones that are on there.
The broadband's the one that threw me out there, because I remember like Sharon Kelly said, well, there was a broadband going down the street and how it went down to the end, and there was nobody on that street signed up on the broadband.
Yeah.
And so I was just looking at, I stopped and talked to some guys on 30th West of Farmington, which I happen to live on. And so I asked the guy, well, how many people on 30th Avenue on my street are you hooking up to? Oh, there's 2 developments that spear off of there, and they said 1. I was shocked. So that's why I'm misleading as to where that blue line shows an accomplishment there. Because we're just as much in need of broadband hookups as we ever was, or even more.
And Mr. Bonaprise, I think this was just an attempt to show a visual.
Yeah,
Those 6 items up there
Good
were
tool.
What's your visual response? I guess you got the point.
distinguished, were clearly separated from the other issues. What we're trying to say is broadband and parks and trails were still up in that top category, but they weren't as high as the others. And we are not giving up on those. In fact, Mr. Luke can tell you, we had a very productive session the other day with people on broadband. While we are getting 85% of the county covered in terms of having the fiber in the ground, we have a very low percentage of people that are hooked up.
that was my
So
point.
that's our next step with broadband. So we're not giving up on that, but I think you'll find we're gonna have some action steps in place to finish it up. There's no, there was never an idea that these priorities are 3-year deals, right? It may take 5 years, it may take 1 year. All we're saying is with this graph is we've got some new ones that are ramping up and we've got some others that we still have to finish. So that's what we're doing here. And we took those priorities that were set by you and we are applying them and assigning them to different committees and divisions within the county to start developing specific action steps. Now, action steps on broadband and parks and trails have already been established, and we're just going to finish those off. The others, we're creating new ones.
What triggered my need on the broadband is we had 2 townships, Farmington and Alden, and the village of Osceola as on our 10-year increase in population and on our real estate sales, and that was the area where the biggest growth was. And they were just in a vacuum there because we had Lakeland north of Highway, basically, and Somerset, it was part of Amory Telecom. And so there, that area where the population was and the sales are. That's where we need
Those
to
are
be.
areas that our recent efforts have led to expansion. And by the end of this summer, much of that will be covered
And
and they'll have access to that.
I see they're working some there now.
Okay, how was that for some feedback? But I think the tailing off piece is a little, it confused both John and I think. So anyway.
It didn't take much on my part, Amy.
What I get is this is just defining the relationships between these efforts.
Very nice.
Because they're not all going to go 100% all the way through because there's limited time, resources, and money to address them. So this is about the relationships between these priorities
That's good.
over time
Okay.
And how
Some
they
are
shift.
ascending and some are descending because
how
we've
they
done some
shift.
work.
and how they shift over time based on.
So is it, Bob, or maybe Vince, you can answer this. So is it gonna be easier or more affordable? Or any way that we can get, after it's in place, to get more incentive and affordable to get much higher percentage hooked up?
That's what we're working on.
We're
right
working
now.
on that.
Yeah.
Exactly what that
That's
meeting,
why we're still working on it.
That's the answer to my question.
that's what that meeting was about.
Yeah, thank you.
And there was some very positive things coming.
Good.
Okay, Bob.
Excuse
Would you like
me,
to continue?
Amy,
Go ahead.
I came to learn, but we're going to, if I can make a
Yeah,
comment,
go ahead.
the dark blue and the red will be identical in their interests 10 years from now. That'll never change. So what we've got to be considering and what we should emphasize are the ones below the top 2. They'll never change. in fact, I'll guarantee you 10 years from now, if this thing was run, those two lines would be right there on the top again. And we have a limited amount of influence on that except financial. So there's very little else we can do.
It's true.
So when you're looking at these, you know they're there and they're always going to be there. So the things we've got to emphasize or really zero in on the gray, yellow, blue, and green for our interests. They will fall off eventually. Broadband will not be probably an issue at all 3 or 4 years from now. It'll be completed. As far as we're concerned.
Good comment.
You're always gonna have, when you look at those 6 items, you're always gonna have subjective and objective things.
Correct.
The subjective things are gonna be your 2 top ones, obviously.
Right.
Because they're just gonna continue to go. And then the rest of them, the objectives, I mean, you can certainly fix a road and a bridge and
Right.
that will decline that effort. I like the colors though, Bob. I wanted to say that just to help you out a little bit. You only got hit by the back wagon wheels.
Better than the stickers.
Should have took out the time scale. And I do acknowledge there's some errors in here. For example, infrastructure should be flatter. Parks and tourism, we're always gonna have deferred maintenance, so that probably be a little bit higher. But again, this is just a visual. It's a product of your input. You see ascending and descending priorities. We've done some work on 4 of the carryovers. Thank you all for paraphrasing.
Barbara's paraphrase, that was helpful. Very good.
Very, very helpful. So actually, the next step in the process is on the next slide. And that is to elicit your endorsement of the assignment of each of the goals. We took a stab at it and tried to align the appropriate goals with the relevant standing committees. And so one product or one objective for today is your endorsement as the HHS committee. Are you interested in staying engaged with supporting housing initiatives? Sounds like you are. And then, of course, that's in your wheelhouse, the reduction of substance abuse. So we just wanted to get that.
And public safety, right?
And public safety, yeah.
And it is
Oh, no,
my
that's-
understanding, we split that up with the parks and recreations.
Sorry.
Sorry, I don't mean to call them that, parks and. So public safety, isn't that under public safety, parks and public works? Isn't public safety under public works? This doesn't make any sense to me for some
The same
reason.
governing committee.
Okay, so we share that, is that what that,
Well, that governing committee has 2 huge departments underneath it,
Yeah.
which is the sheriff's department and then Mo's Public Works. So, thank you. So, to answer your question, within that same governing committee, they'd be splitting up the public safety goal and then the investment in parks and tourism.
Do you need anything from us, like a motion or just we're good?
thumbs up?
You good with that matrix? We're good?
Thumbs up.
Give you 2.
Thumbs up.
Getting a
works.
couple.
Yeah.
Makes sense.
Turn over to Tony.
Okay, so we were assigned 3 of the priorities. Increasing public safety, reducing crime. So this is just the HHS considerations. Public safety hasn't had a chance to add their objectives to this yet. Anticipate this becoming kind of a working document for all of the committees to consider the objectives. So with us evaluating our service delivery, so we're really looking at exploring jail services, increasing mental health and substance use treatment, case management services, group therapies over in the jail. We've seen some successes so far with some jail nursing programming that we've done. We would like to figure out how to expand upon that Always ensuring access to care and benefits. So our connector people are making sure that people are applying for benefits that they're entitled to ease some of that stress of financial burdens. Seeking grants that support increased services. We're always looking for grant opportunities and applying for grants so we can expand our services. We know our county dollars are very limited, so the name of the game for us is finding grants. And expanding on trauma-informed approach to care. So we've done a lot of work in community services on becoming trauma responsive in the care that we deliver in an effort to increase our public safety. Also, prevention programming is big. It's hard to prove. It takes a little bit of time, but we do a lot of prevention programming in behavioral health and public health. So we've got Drug-Free Communities Grant, we've got the Tobacco Alliance, do a lot with pro-sober, pro-social events, just to name a few. These were just real quick to get your juices flowing on ideas that we can have.
Well, my juices are flowing.
Okay, yeah, creative.
Because of that
I'm
whole
wondering about
opioid
that.
settlement thing,
What?
that whole opioid settlement.
Yeah, that's a
funding.
homework discussion, homework for you. So we'll get you pointed back to 2016 and 17, I think is when all that was going down.
It's a done deal,
Yep.
we lost.
Done, yeah.
Only one in the state.
Yeah.
On the service delivery for public safety, is it possible to add something on there about expanding the educational programming for inmates?
Yes, I think that will probably come from the law enforcement side, so the public
Oh,
safety
okay.
side, but we'll
Okay.
make a note of it, that it was brought up in this committee.
Absolutely.
Okay.
Okay. Thank
Because
you.
they already are doing that within their jail staff, the jail staffing is already doing that.
I think it kind of does this a little bit, right, depending on interested volunteers, staff capacity,
Yeah.
all of that.
Okay.
There could be opportunities at the University of Wisconsin program for veterans, incarcerated veterans, if it's not felonious.
Mhm.
So they could actually have credits.
We were just discussing that the Surgeon General had a announcement this past week about the loneliness of people in this country of all ages, especially teens and the elderly, and maybe we need to try to figure out how we can in our county who have issues with loneliness, which contributed to some of those things, substance abuse and other things on that list. And I know that our church has like a calling tree where people have a list of people who they're supposed to be calling periodically to find out how they're doing and do they need any help and so on. So that's a very simple mechanism that maybe we could look at, and encourage people in various communities to start.
I will send to Tanya an interview that I heard with him last week.
Yeah.
That was very good about this report.
Right.
So I'll send you the link.
It's a great read. It's really startling, and it made me really think about
The report.
the report. As we're setting our priorities and looking, and just the implications on public health and mental health and all the things, so many of the things this committee deals with, as well as public safety, public works, so public safety particularly. So anyway.
Okay, next slide. So it's gonna look like a duplicate because it is. So reducing substance abuse, this is what we work on day in and day out here. So it will be a repeat, really looking at those jail services, ensuring access to care and benefits, making sure that they have healthcare, health insurance and other benefits that are eligible, they're eligible for. Looking at grants, expanding trauma-informed approach to care, Drug-Free Communities, Tobacco Alliance, pro-sober, pro-social events, to name a few. for prevention programming. Also some prevention programming in the child welfare departments, public health, behavioral health. Okay, next slide. So supporting housing initiatives. This is one where we're teamed up with environmental services. First box will be the CSD portion, continuing to provide navigator services to connect residents to housing options, encouraging residents to apply for available benefits, and then working with outside partners to identify and find solutions for housing barriers. Next would be
Well, I
from
think there's an
environmental.
error there. There's, those next two objectives are actually under the investment in parks and
Okay.
recreation. So there's a misplacement there. Those two following
Sure.
objectives actually belong under a different goal.
Okay, so can you go to the next, is there a next slide?
There's ours.
There they go.
Yeah.
Okay. So do you want?
Yeah, I can. This is what we came up with. And then shared with the Environmental Services Committee on last Wednesday. The objective would be to reduce development costs. We can continue to work in zoning to streamline and advance or create more efficiencies to our review process. We can look at reducing our fees for developers that are building housing units. You heard earlier today about the revolving loan fund concept. So there's that contribution financially for residential projects. Encourage municipalities to develop infrastructure. That's a tough one. I think some communities have, staff or professional manager in place that can do that. But a lot of our municipalities and villages don't have that expertise. So that's a little bit of outreach with, say, for example, like a Milltown. Nothing against Milltown, but they could use some assistance on site assessments, recruiting developers, things of that nature. Providing county land, we do this periodically every 3-4 years. Last time we were asked to do it, we identified 4 parcels that we put up for auction. So it's a tough one, but because predominantly the county land is county forest and we don't want to give that up. But it's an idea. And then being that clearinghouse for all the local, state, federal housing initiatives, sort of having that one-stop shop for programs. So that's a little bit of outreach as well. The next objective is assisting with housing costs. And again, incentivizing new construction. Again, back to the revolving loan fund or somehow providing capital for startup costs. Looking at our zoning and building code flexibilities, looking at manufacturing houses, tiny homes, accessory buildings. We get this question a lot about allowing 2 dwellings on a parcel. So we're increasing density. These are going to be tricky and contentious, but they're ideas. Encouraging lenders to participate in affordable housing. We are aware some of our local lenders don't take advantage of SBA programs, VEDA programs. They just don't promote it, particularly our mortgage lenders. So that's kind of an outreach piece as well. Again, the promotion of housing assistance programs, and then looking at other models for financing housing development. Did you help out?
That's
with
ours,
this one?
yeah, so the other slide needs to be, we'll just delete that. And then the last slide, I believe, is yours for Parks and Trails.
I have just a quick question. Where can I find the information so I can get an idea for what fees the county applies to developers that are looking to build?
You could look at the land information fee schedule. I can send that to you, Supervisor Wood.
Yeah, just so we can get an idea of what that would look like if we were to reduce or eliminate some of those, like what the impact would be. 'Cause
Right,
I-
we do a time study periodically to determine those fees, so we don't. There is, the cost of those fees are based upon our time. And so in a way, we are taking away revenue to help support housing through the reduction of fees, but it's an idea.
It's just a
Again-
common one that I've heard elsewhere, and I just don't know what the impact would be. So that's just what I want to learn.
Good question.
Madam Chair.
Go ahead.
I appreciate that question, Supervisor, on impact fees. I guess municipalities, townships, villages, cities, there's no, as far as I know, there isn't any minimum, is there? Are they all different? I'm just wondering what the difference is in Polk County. I live down by the county line, and 7 miles from me down there, by Somerset, where they had that amphitheater and that. And I went by there yesterday, and they're building 600 homes in that area right there. And right outside in Richmond, where that turkey farm was there, they're building 800 homes there. And so I don't know a lot about, the different fees, different places. Town of Alden has an impact fee. I know over in Minnesota, boy, the impact fees are, the developers, they gotta build all the streets. They're much more stricter over there than we are over here. But is St. Croix County that much different than Polk County? There seems to be something that is so different that beside the county line, it's a whole different world. It's a different world.
We have the ability to, charge for impact fees. That's a municipality charge, and it's an upfront cost to the developers. So to ensure that the infrastructure is built, whether it's curb and gutter streets.
It's only fair to us taxpayers.
It's something kind of outside of county.
You have an impact fee in Lincoln?
Well, no, I don't have an impact fee. No, I'm more interested in encouraging building.
Yeah.
However, impact fee deters that.
Sure
You
does.
talk about a different world. There's a different world between Osceola Township and Sterling Township. So I mean, they're all different. That's not a county problem. That's individual governmental agency. That's a totally different structure financially and government wise. Totally different structure, home rule, things like that comply different between what we're talking about here in a county level versus a town level. Totally different. We have no influence over them.
Yeah, I wasn't necessarily talking about impact fees specifically. I was talking about the impact of reducing or eliminating certain fees to incentivize building.
Yeah, thank you, Ryan.
We're good. So more to come. You'll see this list grow.
Nice job pulling this together, and
Isn't there another slide on parks and tourism?
There is. You want to go over these? I mean, we can.
But that wouldn't.
Oh,
be
that's not here.
this
Never
meeting.
mind. Never mind.
It's not on the agenda.
Just watching the slides. We don't care about parks. They'd have nothing, and trails. They have nothing to do with health.
on housing interest. Okay, where are we at? Anything else that, are we done?
I'm feeling done, yeah.
Okay,
Number 10.
okay. Preliminary end of year financial report.
Good morning. I'm sure you're wondering, well, why the general government director is up here in front of you when it's not even budget season.
But it is.
It is about to be budget season.
Oh, I knew something was missing from my life.
Yeah, just up one, please. Up to slide 8, sorry. Perfect. So this is the long anticipated review of the 2022 financials. In April, we run, may sound strange, but we run the report for December 31st of the preceding year. It's about when our auditors come in. We feel like most of the revenue for the year has come in, most of the bills have been paid. And so we get this nice thick report by departments. We also get a nice thick report by fund. Today, I'm just going to be covering a little bit about departments and sort of setting some context for what we're doing and why. What I have in my hand, again, are unaudited. Clifton Larson Allen was here last week. We think they're going to have our audited financial statements by about mid-July. But we've got enough to work with budget managers, and that's really why I'm up here today. So about a week or two ago, we shipped this to all division and division directors, and they have license to share it with their departments. What finance is doing is we're looking to see the ups and the downs. What happened in 22, if anything, that was a surprise relative to budget? Either some good news, we got some more revenue, we lowered expenses, or maybe some bad news. Things cost more than we thought, or we didn't get as much revenue. So that's really what we're looking for. I'm not going to talk about GAMP today. I'm not going to talk about veterans. Just briefly about CS and about public health. CS returned about $1.1 million to the general fund last year on a $11 million budget. So that makes me wonder what happened. So I pull out my handy report and I see that we got more in state aid on the revenue side, close to 500,000. This is really small, I apologize. We spent less on personal services, about 350K. And contractual services were down by about 100. There's some other little numbers that added up to a little bit more than $1 million. Yeah, so there was a question raised whether having a surplus was a good thing or a bad thing. It can be a good thing. It can also mean that we weren't able to do all the projects we wanted and spend all the money we intended to on services. So that's the kind of question finance might have a conversation with Tanya or team about. Public health, lots of ups and downs, not a significant difference from budget. The whole point is that we're trying to understand what happened in 22. We'll also look at what's going on with 23 so we can have a good idea going into the 24 budget season. For anyone on the committee that would like a copy of this overall report, I'd be happy to provide it and be happy to come back and answer any questions that you might have. And I'm sure Tanya would be happy to do that as well. When does budget season really start? Well, department and division directors are already thinking about fee schedules. That's sort of the first step. We'll be in finance imagining what, if there are any increases to operating budgets, what those look like, what kind of flexibility we might have in terms of personnel related expense. All that's being put into the sausage machine right now. And we'll be back in touch with you with some updates later, if you'd like to have those.
Can I ask a quick question? So on this, that we turned back 1.1 million, is that a normal amount?
No,
It's up and down. So let's see, 21 about the same, 21.6. This is all on CS. 19, 200,000. It's all zeroed out. 218, something must have happened that I'm not aware of in the budget.
So it actually is about normal since 2019.
Yeah, so you have to consider pandemic,
Yeah.
ARPA money, lots of funding being pushed our way.
Yeah.
Placements, with COVID, we couldn't make placements in some of those higher cost facilities. So that's what we're seeing over the last 3 years, with those monies being given back. I also like to give credit to the managers and that they are staying on top of those cases, those higher cost placements and getting them back out. And into the community, which is better for the person, also better for the budget.
Thanks for the opportunity to be here.
Thank you.
Okay. Now, number 11, the 2024 budget priorities discussion.
Right, so given the previous board priorities, maybe open it up to you to lead discussion on what are the priorities that you are all seeing that you would like us to continue to work on, any new initiatives.
Do you mean base?
I mean, based on the board priorities that I
Oh,
just
our
listed.
board, right?
Yeah.
Yeah.
Yep, so hopefully, I mean, our goal is to roll up to get the priorities that you set up for us in the work that we do. Anything striking with what we showed, anything trigger on areas that we might not be hitting? With regard to reducing substance abuse, increasing safety.
I like the work that your team is doing in the schools with prevention. And I think that there's probably some successes that we need to hear about. But personally, I would like that to be a bigger priority. Or a big, maybe more, I don't know what you say, is like, I'm spitballing right now. But when I think about your team, Tanya, I think about I think about those young ladies that are going into the schools and doing training and you know, the vape pen kind of stuff. And that's why it would have been so nice to use some of this opioid funding, because it directly supports those things that your staff is doing in schools.
It's gone.
Yeah, it's over.
I know, but I'm just hearing about it, so you gotta give me more than a couple days to lose my mind over it.
But maybe the county needs to fund some of those things.
Exactly, doctor. Thank you very much.
One of the things that we're focusing on is rebuilding those relationships with our schools. The pandemic was really hard on that strong relationship prior to pandemia. So rebuilding those relationships so we can get back in there and with that prevention programming and reaching those students.
And one thing I noticed in the annual report was this Wisconsin Well Women program that we only enrolled 2 people in. Am I reading that correctly? Or is that a pandemic, kind of post-pandemic?
It's not a pandemic thing, it is a provider thing. So I think it's Security Health is the Well Woman program, and they moved their service territory. So our enrollments naturally went down because of that, because there aren't providers in this area that, so it's a multi-county Well Woman program. It doesn't mean that services have been reduced, it's just a different, it's a benefit program.
It's a different, so the women are getting served, it's a different mechanism.
Yep.
And, okay. Yep.
I also had a question about how pandemia, I love that, affected reproductive health services in the county. And it looked from the report like it was still quite slow in the previous year. And I'm just curious about, given how much, how challenging all of that is in the public dialogue right now and in the laws. That would be something that I wanted to kind of look at, maybe amping up in the coming year to sort of, I mean, that ship has sailed for a lot of, let's just say that ship sailed for a lot of young women in the last couple of years, but just to sort of get that back online and more active, is that something that's possible?
We are back online. I want to take us back pre-pandemic to the Affordable Care Act. And Affordable Care Act really afforded a lot of people more access to care. So what we've seen the decline in the reproductive health services, women's health services at the public health department as a relationship to Affordable Care Act, where they are going to the clinics now. So our model has changed. up that we are a point of first contact, getting them connected to the resources that are already available to them, always serving confidential teens, but we see that as a direct effect of the Affordable Care Act.
Right. That's.
So
performance time.
they are getting the services they need. It might not be here though.
Gotcha.
Yeah.
Thank you.
And then one thing that I like that we did in our annual report, and I want to see us continue to focus on it, is this food share and food connection stuff of both the food share program, the nutrition coupons for the kids, what's that called?
Power of Produce. Power of Produce.
Yeah.
Yep.
And then somehow if we can, I mean, this is ideal, connect with farmers and purchase food from them, or however that all works. And I keep getting calls from people about the crisis of around food shelves and the fact that we just have these amazing lines of issues and needs. And so whatever we can do in that regard, and I know that opening Centuria, right?
Yes. Yes.
Bought the bank, they bought a bank and they're converting the building. And so that's kind of exciting thing that may or may not, but anyway, I think the food piece is really important for us to continue our eye on that. Anything else?
Well, just that, to look at the priorities that we have through that lens of the new Surgeon General's report on, and maybe this is already just part of how you think, but just with an eye to when we're doing this, what can we do to build more social fabric among people, peer to peer, instead of just always the service person who's getting paid. I did some work with John McKnight about asset-based community development over the years, and about looking at how to connect people more through association rather than through professional. Because there's nothing we can do as a county. We'll never have enough money or time or staff to do it. As opposed to, somebody from Marty's Church, saying, oh, I need a dozen eggs. Can you get me some eggs? Those kinds of relationships. So to me, that it just feels like a mindset to make sure that we're asking that question with what we are doing in our priorities.
To take some pressure off.
Right.
In here, that's the kind of-
Like addiction, like using, there are different levels of addicted people, and using a AA program versus straining, if they're still downstairs, I don't know, but straining those counselors, because there's not a lot.
Do we have AA programs in every community?
Yes.
Yeah, there are.
It's important to know, however, just kind of share that out. AA is very Christian based, and that doesn't work for everyone.
Nope.
And so it's critical that there be other opportunities for people. That's why 12 steps are not the only thing that's being done in clinics and things like that. There's other modalities of care that are more effective for certain people. It's not
And
a
also the-
one stop, one card fits all, so.
And the tribal center is a nice.
That's gonna be a boon.
So.
No, you just remind me, I had a call from somebody that wanted a non-Christian based grief group. A lot of them around.
There's a lot online,
In Polk County.
just online.
Online in
Oh,
general.
doing a Zoom thing. Oh, okay.
Yeah.
Yeah, the Zoom stuff.
Clear Morning. They're out of Oregon. My cousin runs it. Her daughter was killed by a drunk driver. And she started this nonprofit, and it's pretty powerful stuff. Sorry.
I'll tell them.
Yeah, no, that's
Perfect. That's enough.
sweet.
Okay. Number 12, communicable disease report.
Yes. So just the highlights for the communicable diseases reported, snapshot April of this year to April of last year, where we had 60 cases of COVID this year. And last year it was 332, so going down. The Lyme's disease, 6 last year, 1 this year. Not sure if that's related to the slow start of spring or
Here's
nothing
waving.
official on
Nobody
that,
wanted to be
but
out there.
that would be my
Spring.
guess.
How many COVID hospitalizations have we had this year?
That I don't know. I'd have to check on that.
Have we had any COVID deaths?
Yes, I know of one for sure, but I can follow up on that.
I just was listening to a podcast by Michael Osterholm from the University of Minnesota, who's also a counselor to the president. And he said that it's hard to track cases because a lot of people are doing their own thing at home and then they're not reporting it.
Yep.
And so the thing that he thinks are the most important thing is the number of hospitalizations, the number of deaths, and then doing sewage studies and see how much virus there is in sewage. And because currently there's still 1,000 people a week that are dying from COVID. So COVID is not over.
I just did some research on that. I have 500 deaths a day.
Could be, yeah.
It's the fourth leading cause of death right now.
Right.
So with the ending of the pandemic, the public health emergency, it doesn't mean that COVID is gone.
It's not.
It just means that a lot of funding is going away.
Right.
We're unwinding from all of those emergency
I know.
fundings and exceptions that were being made. So there's pandemic is still here. We're not in endemic yet. It's transition period. It'll probably be a few more years before we get into endemic, which is controlled, contained, explained. Part of the other coronaviruses that we see come and go, where pandemic, we're not in international out of controlness anymore, however, still winding down on that.
Yeah. I know that Dr. Osterholm spoke to our medical school class reunion in October, and he said he had looked at a previous epidemic from 1875 that had similar structure as the COVID-19. And although there was no testing in 1875, and he said that lasted about 5 years. And so he estimated last fall that we're going to be still in this for another couple of years before it becomes endemic. And in fact, he himself got COVID in the beginning of March, and he said, I'm instead of running at 110%, I'm running at 105%. And biggest thing for him is fatigue. And so it's and even though he's been vaccinated and boosted, I think 5 times. So the CDC came out last week with a recommendation that people over 65 consider a booster if they've been 4 to 6 months, and then people 6 and over, if they're immunocompromised, be vaccinated again. Because the problem with the mRNA vaccines, it isn't like getting a measles vaccine, which is it lasts a lifetime. The problem with this current vaccine is they lose their effectiveness over time. And he still thinks that Plavix, the oral antibiotic, is a very good thing to take if you are actually ill with COVID. And which he did himself, and he said it kept me out of the hospital.
Is there new strains that
It continues to mutate. So
Yeah, the new strain is XB 1.5 now, then it's 1.6. There's a 1.9 somewhere in the world.
and my point, or my question was, is there new strains that the vaccine doesn't have much effect on?
No, it does protect you.
But maybe not at the same degree.
Well, they think it helps if you just get a booster. So if you're over 65, contact your hospital, or does the county have any?
we are not doing them at this time. It will probably become part of our regular flu vaccine
Right,
clinics
okay.
when we hold those. So you might want to get it before the funding runs away and you have to pay for it.
Yeah,
It's like $130 to get it after funding ends,
which is on the 11th,
2 days,
which is 2 days from now.
2 days from now.
Okay, anything else on that? No, okay. Number 13, legislative event report.
I guess I can make comment on that, okay?
Yep.
Of the 5 committees that I'm on, the 5 steering committees, Health and Human Services was the first one, and that was first week in April. And the legislature wasn't in session, they were in session the next week. So there wasn't anything definite. What I can say we had discussion on was the same thing we talked about here, was on nursing homes. I think there was 42 nursing homes, and they have been declining. I think there was 4 were going out of business, so there was going to be 38. Funding for nursing homes, I said that our county nursing home was pretty much completely free of being self-supporting. Holy cow, were they surprised at that? One county, the entire money from sales tax went to the nursing home. Another county, the entire sales tax went to the county fair. Completely. And I was just shocked about some of the variations, you know, but anyway, there was, the legislature had some great, some counties had some resolutions going into our legislative, Andy Phillips and the gal that used to be our president. They were lobbying hard for some new parts in the legislature. So I don't know how that came out yet. The big thing is to get them to the legislative steering committees.
Okay. Thank you
I've
very
been to
much.
all 5 of them now, and two in Stevens Point, one in Wisconsin Dells last week, 2 of them one in Wisconsin Rapids, and the other one in Boston.
Ooh, I like to drive.
I got 'em
Dude,
all.
You like to drive.
Yeah.
Ugh.
Okay.
Me.
Agenda items for our next meeting, which is on June 13th. Mark your calendar.
9 o'clock.
9 o'clock. 8:30 for you.
10 for you.
Sorry about that.
Yeah, I would like to hear more about mental health. And then you're talking about food availability. Now this Ruby's Pantry. Had some really good talks with the people that run that, and felt like they got like leftover food, and yeah, so I don't know if it's promoting it or tapping them in, or, you know.
Can you say more about what you want to hear about regarding mental health? Like what, help us kind of narrow down who we would bring in to talk about that, or?
Lisa and I could probably put our heads together and.
Yeah. Yeah, like as it pertains to crime, abuse, suicide, et cetera, et cetera.
Okay. The other item that I've been thinking about is as this pandemic money goes away in people's pockets, what is that doing to our poverty impact? I mean,
Or what? Oh, poverty.
yeah, the impact on people's ability to, you know.
I think you're going to see, and we can probably have maybe Diana touch on that, but because of the changes, there's going to be a lot of shocked people who are on certain public assistance benefits, who haven't had to provide information in the past, that all of a sudden they're going to be booted off if they don't, kind of thing. So I think they estimated 80,000 people across Wisconsin are potentially losing benefits
And
They
they were
will have to
receiving max
verify.
benefits during the
And they've been
pandemic.
receiving
which
maximum
will be going
benefits,
away.
which is going away.
Which, I mean, there's two sides to that coin, right? There's the fraud side. There are people who've gotten away with some shady stuff probably, and then there are people who really need it who are gonna get booted off. So it's a double-edged sword. Well, I don't know if it's too early to even have the staff come in, maybe we wait a couple months on that. And see how things are going. Yeah, that might. But it's been something I've been thinking about. Oh, the pandemic relief money is going away and food supports and so what is it?
Is there any way we could influence the legislature
Within a
to
reasonable.
maintain those programs?
No.
I think she's right.
Yeah.
The legislature is tough.
Yeah. We'll send you down the map.
Well, we have medical examiner updates. We bring John in a couple times a year to talk about what's going on in medical examiner's office.
And that might be helpful with regard to the suicide question. John, that's primary.
Yes. Orientation and reorientation, refresher. So we are holding that after this meeting. So this meeting goes from 9 to 11, 11 to 12:30, orientation / reorientation. And we will be extending an invitation to the entire county board to attend the orientation session. And part of that comes from some opportunities that we've been given to speak at the county board on programs that we offer in community services. As you can see from our booklet and our annual report, there's a lot to cover. So we thought it would make more sense to invite everybody to come and hear about the orientation and everything that we do, because it's all inclusive from statutes to the program service and service delivery that we offer.
And when will
So-
that be?
On June 13th, right after this meeting. Same time, same place,
11 o'clock.
11
So we
o'clock
got
to
half an hour
12.
to kill if you get it done early. Okay.
Yeah. Will there be food?
We'll
We're gonna try
see
to do
if-
some food.
I'm gonna see if we can
You feed them, they will
Let's see what-
come.
make it a working lunch, be able to squeeze in some stale potato chips.
Yeah.
Thanks, man.
Yep, we would.
Madam Chair, I apologize, I wasn't here to start. But before we adjourn, could we have it in the minutes and have a moment of silence for? Oh, you did. Okay. Thank you very much.
Yeah, we did that.
Hope it's in the minutes that we recognize our family.
Okay.
Just
oh, go ahead.
One quick request or question that I might have missed. With the loneliness report that was referred to by Dr. Lagos, I believe, was that going to be sent out or a link or something to that?
Yeah, I'll send it to Tanya and get you the podcast that I listened to, but then I should dig up the report too. So-
I found it by Googling US
Surgeon General.
Surgeon General loneliness and you'll get it.
Yeah.
Okay, I'm actually in France right now, and you know, one of the big things in the European world is they have big public squares, and everyone comes out, and I think they have a lot less loneliness. I mean, they have a lot of community sharing things, and I don't know that we could do that, but Dr. Lagos did mention his church, and I'd like to explore that a little bit within our community to figure out ways to address more a sense of community. I mean, we used to have dance halls, we don't have those anymore, but you know what I mean? So I thought that was an intriguing topic too.
Well, thanks for working the time change and being with us this morning.
Oh, yes, it's
Merci
actually
beaucoup.
afternoon here. Pardon me? Oh, yeah.
Okay.
So could you speak one more time to what the time for the orientation?
11 to 12:30.
That's good.
All right, I'll take a motion to adjourn.
Extra long.
Second, or motion, I so moved.
So second.
All in favor? Aye.
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 Opposed, same sign. Motion carries. Thank you, everybody. See you in June.
Yes.